Hello and welcome to G Fun Facts Online. When you're in pain and you swallow a painkiller, what do you picture? A tiny little hero in a capsule, traveling through your body to fight the bad guys? It's a nice image, but the reality is way more complex, and frankly, much cooler. What if I told you the pill you swallow is often just a disguise? A delivery truck for the real hero, a character your own body creates. Today, we're diving into the hidden world of pharmacometabolites, where we'll discover that the true source of pain relief often isn't the drug you take, but the powerful new substances your body turns it into. Every drug you take goes on a journey called ADME, absorption, distribution, metabolism, and excretion. We're zooming in on the M for metabolism. This is where the magic happens, mostly in your liver. Think of your liver as a super advanced biochemical factory packed with enzymes. These enzymes, a big family called cytochrome P450, get to work on the drug, breaking it down and changing its chemical structure. The new substances they create are called metabolites. Now, many of these are just waste products, flagged for disposal. Some can even be toxic, which is why dosage is so important. But a special few are what we call active metabolites. These are the game changers. Sometimes they're even more powerful than the original drug. In fact, some drugs are completely inactive until your body works its magic on them. These are called prodrugs. Let's look at some famous examples. Take codeine. On its own, codeine is surprisingly weak at fighting pain. Its real power is unlocked when a specific liver enzyme, CYP2D6, converts a small portion of it into morphine. That's right, the well-known, powerful painkiller. Codeine is basically a Trojan horse for morphine. This makes it a classic prodrug. Another interesting case is tramadol. It uses a 1-2 punch strategy. The original tramadol molecule works by blocking pain signals in your spinal cord. But then, your liver metabolizes it into a compound called M1, which is a much stronger painkiller that works in a more direct, opioid-like way. It's this combination of the parent drug and its superpowered metabolite that makes tramadol so effective. But the most fascinating story might be one of the most common painkillers in the world, acetaminophen, or paracetamol. For decades, scientists were stumped about how it really worked. The answer, it turns out, is in its metabolite. After you take it, your body breaks it down and, in the brain and spinal cord, combines it with your body's own fatty acids. This creates a brand new compound called AM404. And AM404 is the true hero. It works by activating cannabinoid receptors. Yes, the same system targeted by cannabis, right at the source of the pain signals. It quiets the pain down before it can even travel up to your brain. This is why acetaminophen is great for pain, but isn't a strong anti-inflammatory throughout the body. Its metabolite is a precision tool, working right where it's needed. But not all metabolites are heroes. Sometimes, the byproducts can be villains. The painkiller pethidine, for example, gets metabolized into a toxic substance called norpethidine, which can cause seizures, especially if your kidneys can't clear it out fast enough. Even a safe drug like acetaminophen has a dark side. If you take too much, your liver's normal detoxification routes get overwhelmed, and it starts producing a highly toxic metabolite that can cause severe liver damage. This is a stark reminder of why following dosage instructions is absolutely critical. So, why doesn't codeine work the same for everyone? The answer lies in our genes. That enzyme we mentioned, CYP2D6, isn't the same in all of us. Some people are poor metabolizers. Their bodies can't make much morphine from codeine, so they get almost no pain relief. Others are ultra-rapid metabolizers. They have extra copies of the gene and convert codeine to morphine so fast that even a normal dose can become dangerous. This genetic lottery is the foundation of a revolutionary field called pharmacogenomics. The goal is to test a person's genetic makeup to predict how they'll respond to a drug. Imagine your doctor knowing in advance that codeine won't work for you, or that you need a lower dose of another drug to avoid toxic side effects. This is the future of personalized pain management. So the next time you take a pill, remember what's really happening. That simple pill is just the first step in a complex chemical dance inside your body. It's a story of transformation, where your own body's chemistry unlocks the real power, or sometimes the danger hidden within. By understanding these secret lives of drug metabolites, science is moving towards a future of smarter, safer, and truly personalized medicine. Thanks for tuning in to Fun Facts Online. Well, see you next time.